Welcome to Healthy Conversations. I'm Susan Claiborne with Caroline Canestrari, and today we're talking about our Meds to Beds program, a service that helps patients get their prescription before leaving the hospital. Joining me are Joyce, Director of Pharmacy, and Elsa, Certified Pharmacy Tech. Thank you, ladies, so much for being here and talking to us about this program. But before we kind of get into that, just if y'all can just tell me a little bit about each of yourselves and kind of your role at the hospital.
I'm Joyce Ambrose. I am Director of Pharmacy Services. So I take care of the inpatient pharmacy, the two outpatient pharmacy locations, as well as the pharmacy at the surgical tower.
All right. And I'm Elsa. I actually am a certified technician. I work on the community retail side of the pharmacy where we do the meds to beds program and also fill prescriptions for anyone that wants to fill them within the community.
Yeah, I think a lot of people don't realize that we have community pharmacies at the hospital, so
Yes.
it's very beneficial. I speak for experience. I know you do too.
Yes.
So we'll start with you, Joyce. Can you kind of start by just explaining what the Meds to Bed program is and kind of how it serves our patients at the hospital?
Sure. So Meds to Beds is a free service that we offer patients at the hospital upon discharge from their stay. It is a service that's available Monday through Friday from 7:30 a.m. to 4 p.m. It's a service where we actually fill the prescriptions that the providers want the patients released on to go home and continue therapy and continue to heal. We fill those prescriptions. We can bill their insurance if they are uninsured. We do have competitive pricing offers that can help, reduce the cost so that they can leave with their medications. And once the medications are ready and they're ready for discharge, the pharmacy is contacted and a staff member will deliver those medications to the patient's bedside and collect appropriate copays at the time.
Okay. And so, Elsa, as you said, that's kind of what you kind of work with and kind of do. So, who's kind of eligible for that program?
Who is staying within the hospital is eligible to use it, whether they're on a unit floor or doing the same day surgeries, um, are able to use that service. We provide it for anyone, including even in the ER. So they may not be having to be admitted, but we will still fill those prescriptions if they would want to get them filled with us and deliver them bedside.
And we provide it for one day also? One day?
Also, the 1 day surgeries, yes.
Well, I know from personal experience, this program I fell in love with the program. I had already done the flyers. I knew what the program was, but I hadn't experienced the program. But my husband has had a lot of orthopedic surgeries over, our married life. So we've kind of done the whole you go for the surgery, you leave with the prescriptions. On the way home, I stop and drop them off at the drive through, and then we get home. And then after I've got him settled, then I go back out to go get the prescription. And his last ortho surgery was at our tower. And I know sitting in recovery, they came and asked, had the prescriptions and brought them and said, "These are your prescriptions. Would you like them? And this is kind of what the cost is." And I was like, "Gimme, gimme, gimme," because I was like, that's so convenient. It was so nice to have that just brought to us and be able to leave, have it, not have to take those extra steps. So I can say from a patient standpoint how convenient that was. So I got a new perspective, I guess, on the benefit of the program from doing that. So
Such a wonderful and convenient program. So, how did the program come about, and what need did the hospital identify that led to starting Meds to Beds?
The Meds to Beds program was initiated just to help improve patient outcomes and reduce hospital readmissions. We're able to provide that quality of patient care not only during the stay, but like upon arrival and through the stay and up to discharge. We can help them get the medication so that they can continue to recover and improve their health upon leaving the hospital.
Okay, so how long has ALH had this program, and how has it evolved since it began?
It actually started in 2016 when the outpatient pharmacy was initiated. When it was first implemented, it just serviced the same day surgery, the 1 day surgery patients that we were talking about. But as the hospital has grown, the service has actually grown to meet the needs of the hospital as well.
Yes, yes. And with that growth, I'm sure that it takes a lot of teamwork and coordination to run a program like this. So, what kind of staffing and teamwork and coordination does it take between the pharmacy, the nursing, and the hospital staff and physicians to make this program successful?
it really takes a lot of teamwork amongst us all, with from the time that the prescription comes down to us from the physician or the nursing, the staff nursing, it being sent down, whether or not it's like an allergy or something like that that we have flagged in the system, we're able to communicate and get things taken care of before that medication even reaches the patient. So it's a lot of communication between the pharmacy and the nurses and then the physicians that we all work collectively to make sure that we are getting the patients exactly what they need and make sure that they're going home with the correct and, a lot of safety is implemented to make sure that, they're getting the right medications and going home and not having to come back for something that, you know, they can take care of. Yeah, from not taking their medications, yeah.
Yeah, I can see that. Well, and I know it does take a lot of coordination to do that. And I know I kind of already shared my little story about the benefit for us. But what are some of the biggest benefits for the patients and families that you see for them to be able to get their prescriptions before leaving the hospital?
A lot of the patients really just appreciate the fact that it's really convenient, just like you said, convenience and not having to go somewhere else and then dropping that person off and then having to go back out and waiting. A lot of it is convenience, and a lot of the patients are concerned with some of the medications are not available within their pharmacies. So that we're able to have those and provide it for them is a lot of the compliments that we do get. So really it's convenience. A lot also has to do with the cost of the medication. We do we do offer competitive prices even when they don't have insurance. So a lot of it is the cost and the convenience, but most importantly, it's the convenience for the patient and, them being able just to go straight home and being able to relax and recover.
Yeah. And I know when you talk about the convenience, and of course, we also know that that means it reduces the stress and the confusion for the patients because I know having to come back a lot of times is because they haven't taken their medication or could be that they have not followed up with the medication. And we kind of know how important it is, when you're on an antibiotic to take the entire pack. So we do kind of recognize if we don't follow those procedures, sometimes we don't get the full benefit, I guess, of the treatment. So, um, um, I guess especially with the 1-day surgeries, I know there's always those typical antibiotics and things to
Yes.
get home, so you see that a lot there.
There is a lot with the one-day surgeries. There are patients that get like nip or hip and knee surgeries that they do write a certain blood thinner that they can go home with. Now, that medication Eliquis does have a high copay. There is not a generic available, but within our retail side, we do offer a free 30-day trial of that medication that we use when that cost is extremely high and that patient is not able to afford that medication. They will get a free 30-day trial after that procedure to help them at least get through that and not have to worry about blood clots or anything like that and having to be readmitted. So we do make sure that they're getting the medications that they do need to make sure, and also with them adhering and getting them, they also are able to speak to the pharmacist and the nursing staff to make sure that they are following the instructions they need to in order to recover properly.
And ask questions if they have them. So,
Yes.
and I guess we have seen a decrease in readmissions since implementing that program. I know that kinda was the original, purpose, kinda like what you said. So, um, well, I can speak to having the community pharmacy definitely makes it convenient, and we take for granted when we work in healthcare, the knowledge that we have about things like the, 30-day free supplies or those kind of things that a lot of people wouldn't know exist if we
Yes.
didn't share that information.
Yes. And usually when patients do have high copays, we do try to reach out to them and let them know. That way, if there is a program out there for them, that they're able to enroll in it to bring that cost of medication down. And that's before they leave. And it also helps them for after, they get discharged. They're able to follow through with that program as well and see if there's any other additional help that they can receive through that program.
Yeah, yeah.
And in addition to what she was saying, Also, say that a medication wasn't covered, if we're talking about a different medication, or needed a prior authorization, or the drug's on back order, the pharmacist is at the same facility as the provider. So that's an advantage for the pharmacist getting in touch with the provider to choose, select an alternative medication so that the patient does not go without medication. They're right there, they're accessible. It can be taken care of before they're discharged, and they don't miss doses and, like she said, end up with a complication that causes readmission.
Yeah.
So that's another bonus.
Yeah, definitely. That's like leaving the doctor's office with a script only to find out that you can't get it filled and then try to get back in touch
And
with
they're
their office.
closed.
Yeah, they're closed. So
Yeah.
definitely.
Great benefit. So, I'm super interested in the process, how it works. Can y'all walk us through the process? So when the provider writes the prescription, to when the patient receives their medication at the bedside, what all happens in the in between?
It's a lot of
It's a
work.
lot.
It's
Yeah,
a
a
lot
lot
of
of
work that gets
steps.
put
Yeah.
put once we receive the prescription, but it's just the matter of either the doctor e-scribing the prescription down to us within that pharmacy, or the nurses scanning the prescriptions down to us. And once we receive those, we go through the process of making sure that that patient's in our system. If not, we're able to look them up, input their allergies, their insurance that they've provided upon admittance, and allows us to then fill the prescriptions. It could be from 1 to up to 5. It could even be more that the doctors want to discharge them home with. Um, Once we get that all into the system, we then process the prescriptions and file them under their insurance. And then after that, it goes through the filling and the verification process, which the pharmacist verifies and makes sure that there are no interactions. And then obviously the technician who is going to be delivering the meds will go and look at the prices and be like, okay, is this affordable? Is this what their copay is going to be? And there are times where it's really expensive that we will call up to the rooms and let them know what the cost is going to be. And if they say, "Oh, that's a high cost, like, I'm not sure if I can pay that." That's when we would contact then the nurses or the physician and ask them if there's any alternatives that they can do because of the cost. Um, Once we get all that settled up, we then go take it to the bedside and, confirm with the patient that who we are speaking to is who we need to see, and make sure that everything that we've got on file for them is correct, and, ask them if they have any questions. We verify their name, their date of birth. We list off what medications they're getting, and just go from there. And then that's where the patient either gets the choice to receive the medications from us, or they can decide to take it somewhere else. But that's the choice that they have.
You already answered my question. I was going to ask about the safeguards or checks that are in place, and it sounds like y'all do such a great job with the whole process, all the steps that go into the pharmaceutical process. And I can say from personal experience, I use the community pharmacy. I think our whole office does. Y'all are so efficient and so quick, and do such a great job for our community and for our patients and for the hospital. And I just commend y'all for the amazing work y'all do.
And just making it so convenient, because I know one of the things that you said in there, we talked about the convenience, but having that all in one place, you already have access, like you said, to what their allergies and their medications are that they've given us when they've entered the hospital. And so it's an easy check for us. Whereas if they were having to go to another hospital to get, I mean, another pharmacy to get that prescription filled afterwards, they wouldn't necessarily have access to all that same information for those checks. And if something needed to be changed and you needed an alternative, obviously they don't have that. So just so many benefits. I mean, it sounds like it's a win-win.
Yeah, so you both see this program every day, in action every day. Is there a certain success story or an example of how the Meds to Beds program has made a real difference for a patient or for a family that you can think of?
Or kind of how they've responded, the feedback you've gotten.
Like I said, a lot of the feedback we get is a lot of appreciation for the convenience of it, of them not having to go somewhere else. But we also are able to provide such programs, such as that 30-day free trial, that a lot of people would not know about, that they can use, that they have access to. So Like I said, with the knee surgeries, we do that free 30-day trial. There are also situations where they may not have insurance, and we're able to offer them that low cost medication or prescription. And it makes it more affordable for them so that they are able to comply and not have the unsureness of having to be readmitted for something that got complicated for them. So we do hear a lot of the convenience, and they appreciate the program and that they're able to use that without having to go somewhere else. Because like I said, other pharmacies may not have it, and there may be complications with the prescriptions where that pharmacy would have to call us back or call the physicians, and it's hard to get a hold of when they're not in office. So a lot of it is a lot of the appreciation about the convenience and being able to provide them that service without them having to go somewhere else where they just want to go home and take care of the patient.
Well, it's a great program. They don't have to sign up for it or anything like that prior. It's just offered when they're there. Well, obviously, it's a great program. Are there any additional kind of ways that you plan to expand it or build on it? I don't know if there's any opportunity for that because it does sound like such a great program. But
Well, I think it just kinda goes along with our mission to be the difference. We'll constantly change as needed, develop the program better if we can, just collaborating with our, fellow staff members, the nursing staff, the providers, the patients, and the pharmacy just to see if, the process could be optimized to work better to improve patient outcomes. But I will add to what Elsa said about, the patients loving the convenience and the comments they've made, but Carl also mentioned that not only did they appreciate the convenience, they appreciated the time and the effort, because there is time and effort that goes into it to get those ready and delivered to the room. Um, but as far as getting that out there, I know there are pamphlets around the hospital, and it's included in their assessment upon admission. It's one of the questions that it's like a hard halt question. They're asked if they want to have their prescriptions filled at the pharmacy upon discharge. And of course, they can change their mind in between the process once they're ready. And if that happens, they can fill those elsewhere.
okay, well, that was one of the questions I was going to ask is how people kind of learn about it or how they kind of make sure that they take advantage of that service. I just love the name Meds to Beds. I'm like, oh, that was so creative. Whoever kind of came up with
Yeah.
that Meds to Beds.
So we have flyers around the hospital, and they can also ask the nursing staff or someone, and let them know that they want to get their prescriptions filled with us.
Well, it was a great service for us for sure. And I guess in closing, I kind of want to add so our pharmacy is kind of three components. There's the inpatient pharmacy, and then we have the community pharmacy that's located at the main campus at Athens-Limestone Hospital. And then there's a community pharmacy that's located at the tower off of Highway 72.
And there's also a pharmacy inside that services the surgery
Okay.
department
Okay.
at the tower.
All
So
right.
there's like 4 pharmacies within the
That's
pharmacy umbrella.
That's awesome, and that's a lot, but it is like you said, it makes us it's part of that be the difference, making that convenient and serving our patients at the highest level that we can. And the tower also has a drive-through. Yeah.
And
So
they have different hours
and they have
also.
yeah, and they have different hours, that's true. But it's one of those anybody can use it in the community as your regular pharmacy. You
Yes.
have you don't have to be a patient, you don't have to be an employee.
Correct.
Anyone can get their prescriptions filled there.
Yes.
Great. Anything else that you ladies would like to add about the pharmacy or the Meds to Beds program? I know we've recently celebrated Pharmacy Week, so I know y'all are a big, important piece of everything that goes on at the hospital. So we certainly appreciate y'all and are glad y'all kind of had some time to be able to celebrate.
Yes, it was nice. It was nice to celebrate together.
Anything else y'all like to add for closing?
Um, no, just that we're here 5 days a week.
Yes, sir. Well, thank y'all so much. We appreciate that. We appreciate the creativity of coming to think about programs like this that can serve our patients. Thank you, Joyce and Elsa, for sharing how Meds to Beds helps patients transition home with peace of mind. It's one more way Athens Limestone Hospital continues to put patients first. Healthy communities start with healthy conversations. Thank you for being part of ours.